Ads, power, and period. Welcome to And That's on Period.
We're three high school girls
with a mic, a mission, and a message to smash the stigma and speak up about period poverty. And that's on period.
Welcome to the first episode, and that's on period. We're your hosts, Pamithi, Inulya, and Gangulel, three high school students from the US and founders of OurPromise, a youth-led initiative dedicated to ending period poverty in Sri Lanka.
We launched this podcast to spark dialogue, challenge harmful stigmas, and highlight voices that often go unheard in discussions about menstrual health. In this episode, we'll be diving into the topic of the harmful effects that period poverty has on a girl's education, especially in Sri Lanka. We're also thrilled to be joined by our very first guest, Dr. Katymay Malone. Dr. Malone is a clinical assistant professor and the program coordinator for the Master of Public Health program at Clemson University. She holds a PhD in health education with a cognate in women, gender, and sexuality from the University of Cincinnati, as well as degrees from Columbia University and Cornell University. Her research centers on menstrual health, including a dissertation on menstrual changes, management strategies, and sources of information in adult menstruators. In addition to her work in higher education, she has served as a K-12 health and sexuality education coordinator and teacher, a gynecologist teaching associate, and a volunteer health officer with the National Women's Health Network. So, Dr. Malone, welcome to our podcast. We're so happy to have you here today.
Thank you. I'm glad to be here.
I know. And then for our very first question, can you tell us what inspired you to focus your research and career on like the health education field, specifically in like the areas related to women, gender, and like sexuality?
Yes, that's a really great question. I don't know if I've actually been asked that before. So, in kind of thinking about my background, so kind of growing up, I was always really invested in athletics, health-related type behaviors. And then I think kind of transitioning to college, really diving into some of the research in psychology, human development, and exposure to health education as well. I always knew I was interested in health education kind of generally and across the board, but really starting to see the research on the overwhelming disparities that exist across genders really kind of intrigued me and oriented, I think, my interest more towards girls and women and underrepresented populations where we tend to see a lot of those disparities that exist across all aspects of health, medicine, education.
Yeah, definitely. That makes sense. And we mentioned in our introduction a little bit about your dissertation. And so your dissertation explored menstrual changes and management strategies in adult menstruators. So what were some of the most surprising or important findings from your research?
Yeah, that's a great question. So I think overall, we had about a little over 550 responses, unique responses from different individuals that participated in that survey that I had distributed across states within the United States. And so I think some of the sort of more alarming sort of responses or numbers that we saw coming back were that a really large percentage of women who responded to the survey noted that they experienced at least some menstrual changes or symptoms that impacted their life in some sort of negative way. And so that number varied a little bit across the two studies. I was seeing numbers around 85% or more that were reporting sort of these negative changes, experiences associated with their menstrual experience. And then I think also the thing that really stands out to me is that I had inquired about all different types of what I call menstrual management strategies. So, really, just kind of the definition of that is things that people who menstruate do to manage some of those changes or negative symptoms that they experience, either prior to menstruation or during menstruation. And so really it was just interesting to see the high percentages that were reported across all different types of menstrual management strategies. And so kind of an example of a range of strategies could be something as simple as just resting as a way to manage perhaps tiredness or exhaustion or pain that was reported during menstruation. And then other examples might be participation in specific types of exercise, particularly relaxation type exercises. Um, some additional examples include pain management through over-the-counter medication, or actually even prescription-based pain medication for those that experienced higher rates of pain. It could be the utilization of different types of menstrual products to try to manage pain or other symptoms associated with menstruation. I know one area that I reported on that we haven't really seen a lot of research on is whether or not people would try to utilize marijuana in some capacity, especially to manage a range of symptoms, but in particular, menstrual pain or dysmenorrhea is the formal term for that. And so I think I saw about 13% of respondents that said they had relied on marijuana use to manage menstrual pain. And so that's an area that I would like to see more research kind of focused in so that we can understand, is this an area that really should be considered from medical marijuana perspective as far as prescription-based medication for people that do experience menstrual pain and other symptoms that it might be helpful to kind of manage.
That's really interesting. Thank you for sharing that with us.
Yeah.
Yeah, thank you so much. And so your work in menstrual health that you mentioned before kind of leads us to our next question, which is, what are some common misconceptions about menstrual health that you frequently encounter in your work?
Yeah, so I think probably one of the larger, sort of broader scale misconceptions is that girls and women are doing just fine managing menstruation and that everybody has access to all of the products that they need in order to successfully manage that experience. And the reality of that is that's just not true. Even here in the United States, right? A very industrialized country, there are literally millions of girls. I think the most recent estimate is around just over 16 million girls and women that do not have regular access to the appropriate menstrual management products to successfully manage menstruation, right? And that's just here in the United States. If we're looking on sort of a broader global level, I would say on any given day, I think the estimate is around 300 million girls and women are menstruating. But worldwide, 500 million girls and women do not have appropriate access to menstrual management products on a regular basis. So I think that just really goes to show the massive disparities that exist when it comes to right? This very natural, common occurrence that is occurring in about 50% of the population on a regular basis. And so I think that's probably the number one misconception. I think the other aspect or another sort of misconception that I've sort of garnered through this research or through my own research is related to people thinking that girls and women are managing any sort of negative symptoms well, and that it's not impacting their quality of life or their day-to-day activities on a regular basis, at least. And that's also not true. We're seeing really high rates of girls and women that are reporting significant menstrual changes, significant negative symptoms that are impacting their quality of life. And that can include things like their access to education, right? Whether or not they're going to be able to attend classes regularly during that premenstrual period or during menstruation, if they have to regularly miss a day or days of school in some cases, depending on the severity of the symptoms. It could also impact things like being able to engage in employment consistently, participation in sports or athletic activities can also be impacted by menstruation. And I think the important piece is that there are many girls and women who are experiencing pretty high rates of dysmenorrhea, which is painful menstruation, just to kind of break it down into the easiest terms. And so that is something that, right, if someone is in pain consistently or on a regular basis every single month, perhaps for days at a time, you can expect that that's going to impact somebody's quality of life pretty significantly.
No, for sure. I feel like I definitely connected to what you said about the first misconception about how it's like such a push down issue because the
Yeah.
three of us we ran like a fundraiser at this cricket Sri Lankan cricket festival to raise some money to donate pads to these girls in Sri Lanka, and many of the people that came didn't really know that this was such a big issue in Sri Lanka, and
Yes.
sometimes like mostly towards like the older generation they didn't really want to talk about it as much with us, or they felt that it wasn't necessary to talk about it, which I feel like it's such a push down issue, and usually issues that like relate to like pain, because like it is like pain that you're causing when they don't have access to these products, they tend to get talked about more, but this one specifically just pushed down so much, which I don't know.
Right, right. And I think I do think that there's a relationship there between it being girls and women who are having these experiences versus if it were boys and men that were experiencing menstruation on a regular basis. And so perhaps we would see more support in that case due to these very much ingrained gender-based disparities that exist and biases that exist.
Yeah, definitely. I feel like if it was the other way around there'd be more attention on the issue. But
Yes.
and then I just wanted to ask specifically, like, was there any sort of like point in your life where you saw something that made you realize like menstrual equity is like super important? Was there like any experiences you want to share where you saw period poverty or something like that made you realize like, wow, this is a really important issue? Like any experiences?
Yeah, I think so. Definitely my prior professional experience working with students really of all ages, so children, middle school, high school age students, in both like a formal K through 12 school environment, but then also as a previous program director for academic camps that were residential for students. So I encountered students on a fairly regular basis, girls in school, especially middle school, who just didn't have regular access to menstrual sanitation type products. So tampons, pads. Most girls had never heard of like a menstrual cup or menstrual disc. I think that even today, right, a lot of people are still kind of in the dark on some of the products that exist. And so I think really just exposure to some of my students when I was teaching in inner city schools that did not have regular access to those products and figuring out how to connect them to regular access, right? Because one of the challenges is that a lot of times if someone comes to you with an issue, like a student, for example, um, it might be an issue that you think that you're able to resolve in like a one-time thing, but the reality of menstruation is this is something that's going to continue to impact those individuals, those students every single month for the most part moving forward. And so it's not something that can necessarily just kind of throw a band-aid on in the short term. We really need to be thinking about what systems and what type of funding are we willing to allocate to help these individuals get connected to the appropriate menstrual management products that they need.
Yeah, and I think that one of the um main things that we had in our project in our in the Our Promise project is that we didn't want to just give pads to the girls because that's not very sustainable. Since menstruation is a monthly occurrence, it doesn't make sense to just go like one time to Sri Lanka and just distribute pads. That's why I think we wanted to install pad dispensers so that it can be like more sustainable and the girls can have access to pads throughout the school year and not just for a few weeks or for 1 month. Yeah.
Yeah, I really appreciate that. The longer term sustainability aspect and kind of like funding and product replenishment aspect is really important.
Yeah, of course. And our next question kind of relates to the research that we're doing with you. So,
Yeah.
why do you think menstruation is still a taboo subject in many schools and communities, especially in countries like Sri Lanka?
Yeah, that's a really good question. And I think that just because it kind of falls under the region of anything connected to sort of reproductive and sexual health education, I think in general, kind of that category has really been deemed as being very stigmatized over the decades, right? I do think we're starting to see somewhat of a shift in that, especially I would say in the last 10 years, where more people are starting to talk about the educational piece connected to reproductive and menstrual health. Um, but I think just because it was connected to an aspect of reproduction and sexual health, that kind of automatically, that kind of lumping into that category, labeled it as some sort of stigmatization, for girls and women's health. And I think also, again, because it's occurring, right, primarily in girls and women, people who menstruate, that sort of ongoing misogyny or gender disparities that have existed, gender biases, gender stereotypes that have been tied into anything that tends to be strictly associated with girls and women. And the reality is that, historically, girls and women were often excluded from medical research and health research. And so we really don't have as much information as we would like to think that we have or that we know about a lot of these medical topics that specifically impact girls and women.
Yeah, I
Go
totally
ahead.
agree. Since like we were already like labeled as a minority group, kind of like the whole thing kind of also widened the whole gap because, and it continues to widen because of the whole wealth gap and how girls are dropping out of school for this
Yeah.
issue.
Yes,
So,
yes, very much
yeah.
so. I think I was pulling in kind of preparation for our talk today. I was pulling some of the statistics out there and data that exists related to like low and middle income countries and Sri Lanka in particular. And sort of the global estimate or range is that about 15 to 30% of girls end up dropping out of school specifically due to menstruation related issues, or non-access to appropriate menstrual management products. So that's 15 to 30%, but in certain countries, we see that range actually extend even higher to 40 to 50%, potentially even more. I know specifically for Sri Lanka, when I was looking at the data on that country, that it was potentially up to 50% of girls in school age range that end up dropping out of school, or are absent for significant periods of time due to menstrual related issues or non-access to appropriate menstrual hygiene products. So it's a very, very high percentage. And then we think about that, right? If girls do not have consistent access to education or they have to drop out of school or even just missing larger periods of school, over time can reduce the likelihood that they're going to complete school, that they're going to graduate from school, that they're going to receive the same level of education as their counterparts, right? Males in this particular case. And so that then impacts the ability to earn a sufficient future living, right? Financial living, financial sustainability, being able to secure some sort of professional career to be able to continue to sustain themselves financially in the long run. So it's kind of this domino effect that we see connected to menstruation as that starting point that could potentially really upend a girl's and future woman's life, all stemming from non-access to appropriate menstrual products, or having such severe and significant symptoms that it's impacting their ability to go to school, maintain a job, or participate in athletics.
Yeah, that's completely true because I was looking at some research prior and it's a whole domino effect because then it leads girls to be involved in like getting married at a younger age because they have no way to support themselves and it just leads into this whole cycle of abuse and I
Yeah.
don't know, it just continues to widen the wealth disparity gap. So yeah, that's
Yes, yeah,
yeah.
that's very true. One sort of piece of data that I thought was interesting that I pulled was related to girls who have regular access to pads, for example, during menstruation, have reduced risk of infections, including reduced risk of acquiring sexually transmitted infections and bacterial vaginosis. So there is linkage through research that has been found that regular access to such as menstrual pads can reduce risk of infection and sexually transmitted infections throughout life or later on in life.
Yeah, that's definitely like a really alarming statistic. I didn't even know that that was like a thing. But our next question is kind of a hypothetical question, but if you could change one thing about how menstruation is handled in schools, what would it be and why?
Gosh, only one thing. I have kind of like a two-part one thing. So I think my response to that would be it really is like tied together. So having consistent free access to a variety of menstrual products, so including menstrual pads, tampons, ideally even menstrual cups or menstrual discs to have a variety so that a menstruator would have the option of choosing what best fits sort of their own experience and their preferences. But I think that also really goes hand in hand with requiring some sort of comprehensive menstrual and sexual health education so that people, especially individuals who menstruate, understand what menstruation is, what they can expect, and how best to successfully manage menstruation, to really reduce any sort of negative symptoms. So I'd say it's kind of like a two-part that goes together, but having regular access, I think, to menstrual products is really that number one piece. But you really need to also provide appropriate education connected to understanding menstruation and use of those products.
Yeah, no, I definitely agree with that. I think having like menstrual products should just be the bare minimum because it's like it's a necessity. And I think a lot of the times, especially in countries like Sri Lanka, it's so rare to see that it's considered like a privilege. But I
Mm.
think because it is like a monthly occurrence, it should be the bare minimum, and I think it should be present in all schools. And the educational component is also, I think, really important and something that's undermined a lot. Because especially in countries like Sri Lanka, that's not a priority at all. But it's really important because if once you start your menstrual cycles, it's really important to educate yourself about what you're going through. And yeah.
Definitely. Yeah, how about if I kind of return that question to all of you? What are your thoughts on sort of what would be the number one thing? Would it be the same thing, kind of providing menstrual products? What else do you think should be attached to that?
I think my thing would definitely be like making this issue more of a priority for everybody to understand, because it just bothers me how overlooked it is when it's such a
Yeah.
big problem, just because I don't know of the taboos that surround it, and how a lot of people, especially within the Sri Lankan community, are a little bit unwilling to admit that this is a genuine problem and kind of even talk about it really. So
Yeah.
I think my thing, I feel like the first step towards like making a change within this issue is like we have to get people in the community talking about it. So I think that's my one thing, like making it like, if you're uneducated, like educating people, and then trying to get people to understand like this is a big priority, you can't just keep overlooking it because of the stigmas that surround it.
Yeah. Yeah, very much so.
Yeah, going off of Gangulel, I also think it's a big thing to educate both genders and not just women, because I think it's like a whole thing that everyone has to be involved in to make a change. So it can't just be, oh, you're educating the woman and they know about it before they get their period. It needs to be like, oh, like the men know about it too, so they can provide to their new households and not make it a thing for their
Yeah.
families.
Yeah, and I think that's a really, really good point, Pamithi, because that also helps remove some of that stigma that it's been entrenched in, right, for decades at this point. And so I think the more people of all genders are able to be educated on it and kind of have the appropriate terminology can also help them be a little more empathetic and understand what people who menstruate might be experiencing.
Yeah, definitely.
And then kind of to um end off on the podcast, I know that many people know about the issue, but they don't really know what to do, except kind of like they don't know how to approach a solution even if they do find out about the issue or learn about the issue. So like what are some small but like impactful ways that the young community especially could help to address the problem of period poverty, raise awareness, or take their own small steps?
Yes, I'm so glad you're asking this. So for this question, I think one of the first things I think about is, right, there's a lot of power in young individuals, and I don't think young people always realize that or are sort of emboldened to kind of grab onto that power and focus on a topic that they're really interested in or invested in, but young individuals really do have a lot of power. And it could be something as simple as connecting with a small group of your friends, perhaps in whatever school you attend or schools around you that perhaps are not as financially sustainable or successful. And connecting with perhaps a health teacher, a school nurse, a school counselor, a principal or school administrator to one, find out sort of do they provide any sort of education related to menstrual health and menstrual hygiene? And do they provide any sort of free products? And if not, what would sort of that process look like for trying to perhaps raise awareness within the school, within the community, within their own small networking circles, through any sort of like crowdfunding that's so popular nowadays? And I think this is a topic that a lot of people would latch onto when they understand the significance of it, and the impact of it, right? A lot of times individuals are willing to give money or donate resources to a cause that they themselves feel connected to, or that they feel like their direct funds, their direct resources are really truly making a difference and going directly to those populations in need. So I think it's starting small. A lot of grassroots groups start that way. A small group of friends or individuals committed to a particular issue, and they just try to connect locally first within their community, within school systems or community-based organizations to find out what is being done in that area, if anything at all. right? Perhaps nothing is being done currently, and so they're kind of starting from scratch or from baseline, and they can figure out what are those next steps they'd like to take to be able to provide those free menstrual products, and perhaps provide some education or connect with some sort of health educator or public health educator within the area, or within a department of health or a ministry of health in order to get that education into the school system or recreational centers or community-based organizations. There's so many different ways. And then I think in places where people do have regular access to like social media, right? It's very easy to spread information that way. You just want to make sure that you're spreading correct information. One, I would always say make sure that you have someone that's really an expert in that area or a medical doctor, physician assistant kind of review that content before kind of putting it out into that social media atmosphere. And so I think there's so many different ways that you can really do good in this area, and increase access to menstrual hygiene products, and then also helping people who menstruate understand kind of what to expect and how to navigate situations when issues do arise. It could also be connecting with a local health clinic or medical clinic to see if there's any nurses or physician assistants or medical doctors that would be willing to speak with you or speak within a school system to get that education kind of flowing in that area. And also not just for students, but educating parents and adults, I think is just as critical, because a lot of times they didn't get the information growing up. And so, learning about how menstruation could impact girls and women, I think, is really crucial at all ages. And so I just think there's so much good that people can do, even if it's just you and your best friend starting off. It really is just right. If there's a will, there's a way. There's a way to figure out how to make some change, even at a small level starting off. And then that could potentially balloon, right, as your focus grows or as additional resources come in.
Yeah, I really like your idea about starting off with the younger generation because the
Yeah.
younger generation isn't so much affected by the stigmas or the taboo surrounding it. So once they realize, oh, like how severe it is, like once you educate them, they're more likely to, start to take an active stand against it and like, even educate people older than them. So yeah, I think that is the
Yes.
way to go with the younger generation and then build off from there.
Yeah. Yeah. And I think also just checking into what organizations perhaps exist in a particular location that might already be connected to this issue or this field. Perhaps they have resources already established and they just need help with packing like period packs or boxes to distribute to local schools or communities, or town center type places where people could more easily access those menstrual hygiene products.
Yeah, I think a small act goes a long way within this issue. And I think it's like, yeah, even just doing like one small thing can help so many different people within this issue. So it's just like important to start. And I feel like this is really good information for our audience because many people like know about the issue and they don't know how to go about helping it. So this was great.
Yes, and I think all three of you are a perfect example of this, of taking action, right, in a small capacity starting off to increase education, knowledge surrounding this issue, and to understand what girls are experiencing in Sri Lanka or other locations potentially down the line.
Yeah, of course. And that was our last question. So thank you so much for joining us, Dr. Malone.
Yay!
Um, we're so grateful for your time, your insights, and for inspiring people who want to make a change in our community like us, to keep pushing forward. I definitely learned a lot of new information today, and I'm really grateful for that. And to our listeners, thank you for tuning into this episode of And That's On Period. Stay tuned for more episodes, which will be released every Saturday at 6 p.m. Eastern.